Greetings, friends and followers. This is Nurses Talking, and I am Dale Barzi. And as always, if you like what you see and hear, subscribe, leave us a comment, let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. And today, I have the very great pleasure of welcoming Jennifer TORREZ out of Michigan, USA. Jennifer is a critical care nurse. She is the founder of PRISMqd, and she says that translates frontline insight into real-time safety intelligence. She is, laser focused on patient safety. Um, and she's had over a decade of health experience in healthcare systems as a strategist in clinical operations and patient safety. So, Jennifer, welcome, welcome, welcome.
Thank you so much, Dale. I appreciate it. Great to
My
be here.
absolute pleasure. My pleasure. But firstly, what brought you to nursing? Why are you a nurse?
I became a nurse during a major life transition. I was newly separated, raising my two boys, trying to build a
Mhm.
life, and nursing offered a path where I could support my family and help other people.
Yeah.
I uh, I wanted to work someplace where, in some way where I was able to contribute to
Hmm.
bettering other people, helping other people. And
Yeah.
so after, so I left an abusive marriage. I lost my job in the '08 crash, and
Hmm.
I had been going to, night classes and, to finish up my degree. And
Hmm.
um, I spoke to a lot of different people about where to go. I was really kind of focused on med school. I really wanted to go to med school. I didn't receive a lot of support for that decision. Even from the physicians that I spoke to, they were like,
Hmm.
no, don't do it. Don't do it. And I'm like, oh man.
Hmm.
So at any rate, my mom was like, I will pay your rent if you want to go to nursing school. And so I did. It was there was quite a long wait list. So I was
Hmm.
um, for about 3 years, I was waiting just to even get into school.
Yeah.
And during that time, I went and worked in sleep medicine. So had this other foundation for nursing too, which I thought was
Hmm.
really great. And at any rate, that's how I got where
That's
I
how you got into nursing. That's how you got
yeah,
into nursing.
yeah.
Um, so what kind of areas did you work?
I started in pediatric home health. That was my very first job after nursing school. I did that for a couple of months, and then I um, went to work for a school district. And so I
Mhm.
was one of three nurses. We were covering 23 schools in the district in one of the most economically depressed areas of the state of
Mhm.
California.
Mhm.
Um, that was really sad. It was really, really sad. I did that for about 9 months, and then I got my first acute care job at a fantastic hospital in Chico, California. They're Plain Tree designated, and I started in their definitive care unit, which is a high acuity step down. We took
Mhm.
vents, we did drips and things, and I floated into their neurotrauma and cardiac ICUs. And then I came back down to the Bay Area and started in an ICU, a 6-bed ICU. I moved to our sister hospital, 24-bed CVICU. We did everything, neurotrauma, everything basically up to like ECMO. ECMO is kind of where we ship
Yeah.
people out.
Mm-hmm.
So during that time, I trained in CVICU. I was one of a handful of the heart nurses. I also trained in rapid response nursing.
Yeah.
And that is, I feel like where I got the probably the best education on like how everything works, how everything
Mm.
comes together.
Comes together. Mm-hmm.
Yeah. So, there's very few opportunities to get from, to see every step of the way where, patients are admitted, where they
Mm.
transfer, why,
Mm-hmm.
what's going on. And so that was a really great experience. Um, in addition to that, I was on the evidence-based practice and research councils through our shared governance. And I did a lot of public health outreach and stuff, both with the school district and then with my
Yeah.
critical care. And I'm currently serving as chair of the Policy and Systems Committee for the Global Patient Safety Initiative. I also sit on the Leadership and Steering Committee and the Government and Liaison Committees for that initiative as well. So
That's quite a bit.
that's what I've
That's,
been up
that's
to.
That's quite a bit. And a lot of that, I think it sounds to me as I'm listening to you talk, you started out in one area and you somehow seem to have been guided into areas that all now come together to prepare you for this focus of patient safety.
I I feel very strongly that that is true. Um, I I think I might be the only nurse that has this experience, that has so many years in critical care, in rapid response nursing,
Mm-hmm.
and I have probably 12,000 hours of studying sleep,
Mm-hmm.
which is, an underutilized um,
Underutilized, yes.
way to assess patients and their health, you know.
Mm-hmm. Mm-hmm.
So yeah, it's all kind of coming together, and I think especially the sleep part is um, really, really important, and we don't spend enough time on it. We don't assess our patients well enough for it, and sleep disordered breathing is a huge
It's
contributing
huge.
factor to cardiovascular disease, to, strokes,
Even to
and
mental health. But I shouldn't even
absolutely.
say even, as well
Yeah.
as.
Yes. Yeah. So, yeah, it's all coming together. And then I also, what I went to school for originally was psychology. So I
Mm,
do have a degree in psychology and been very into neuroscience. So I'm kind of bringing all of those things together. And, really every step of the way, every decision that we make in building this is, how it's not just a matter of like, what color are we going to make this? Oh, I like this one color, or this, whatever. Everything has to benefit the body and the mind.
yes.
So every single decision that we are making is grounded in evidence-based practice. It's grounded in the latest research from all areas, different industries, different applications. We are taking all of that and putting it together to,
Mhm.
essentially make what is probably the most advanced clinical interface that exists.
Okay.
Yeah.
So You founded this PRISMqd.
Mhm.
First of all, well, I'm intrigued by the name. I think I get it, but tell me about the name.
So it is kind of a working name. It is predictive risk and safety monitoring every day. So I kind of put the QD on there because PRISM is a very popular name.
Mm,
And it stands for exactly what we need every
mhm.
day to keep our
Every
patients.
day.
So basically, it's a clinician-founded safety ecosystem. We're using a wearable with expanded biosignals and predictive intelligence to detect risk before it becomes harm. The physiologic data, the AI analytics, trauma-informed design, they're all designed to prevent failure to rescue events. They are designed to give clinicians the information that they need when they need it before the patient's crashing, so that we can intervene appropriately
Mm-hmm.
in a timely manner.
Mm-hmm.
And the whole issue about failure to rescue is that these are all preventable events. Like these are things that should never be happening, but they
Mm-hmm.
happen
Mm-hmm.
um, so frequently that I think we almost forget what that term means and what the implication is. That
Yeah.
those are lives lost. Those are
Yeah.
families devastated by, you know, um, many things that are out of the control of the nurses at the bedside. And there's so many different contributing factors that, we have to look more deeply at our systems.
Yeah.
We need to look more deeply at how we are conducting ourselves and the decisions that we're making, in our personal lives, in, our work life, and how those are affecting how we work and,
How we
and,
show up
and,
there.
and the conditions under which we work.
Yeah.
So,
Yeah.
you know, uh, and while, the PRISMqd, that, the ecosystem itself is geared towards, early warning, and preventing failure to rescue. Um, we are designing this very much for the clinicians as well.
Mm-hmm.
Um, to protect their nervous system and also protect our patients' nervous systems, right?
Yeah.
They're exposed to all of these same things as we are. And, the alarms and the constant beeping and
Yes.
the
Yes.
lights,
Yes.
all of the things are, they're not designed to work with our,
Yes. Yes.
they're just not designed to work with our bodies.
Mm-hmm. Mm-hmm.
And they cause excess stress, and dysregulation that impacts patient care.
Yeah, it does. And as all of those things that you mentioned, um, sometimes go unnoticed
Mhm,
in the way we work just because it becomes so part of our daily routine
mhm.
that we don't notice the impact on the patient lying there,
Right.
or even
So,
on ourselves and our colleagues.
yeah,
And our colleague is on edge today, and we didn't attribute any of it to all of this stimulation.
right. And it's, one of the big things that I am focusing on is trauma-informed care,
Mm-hmm.
embedding that. I am, you know, utilizing nonviolent language. My requirements are trauma informed, decolonized, um, safe for everybody that interacts with it. I don't want there to be any part of our system that, causes harm.
Yeah.
I don't want, the color of the screen to interrupt your circadian rhythm.
Yes,
I
yes,
don't,
yes.
I don't want our, and I don't want our nervous systems to end up being, triggered by all of this to the point where it interferes with our ability to think quickly and act,
Yeah,
in a
yeah.
timely manner.
This
Yeah,
is a huge vision you have.
it is. It
This
it is.
is
It is.
this is a
Uh,
huge vision.
it,
So let's see. In about, let us say in 10 years, where do you think you see this?
um, PRISMqd, I hope
Mhm.
in every hospital. And we are building to global standards so that
Yeah.
we can, use this in countries that, are maybe just sort of getting online with, their healthcare systems
Mhm.
and, start with the best, start with the latest tech,
Yeah.
uh, we just want to make it available for everybody. And we want to make sure that those that are not being taken care of are taken care of.
Are taken care of. Are taken care of. So I'm going to just switch for a little bit. Having come to nursing in a roundabout kind of way, and that wasn't really your first thing, or even maybe your second thing. Having been here in all of this time and gathered all of this experience, and now being innovative with it, what advice do you give to someone who wants to be a nurse?
Um, I would say, and this is actually for anybody. I think everybody should read the book, The Body Keeps the Score, uh,
Hmm.
by
It does.
Bessel van der Kolk. It's an excellent book, and it's something that I wish I had read years and years ago. And honestly, I feel that it is essential. I feel like it is essential for the nurse to understand themselves and, uh, process their lives and what is happening with their, nervous system. Um, and it's essential to understanding your patients. Um, I really feel like I would have done a lot of things different in my own nursing practice if I had this knowledge earlier. So I would absolutely recommend to read that book. Learn how trauma shapes your body, how it shapes your system, your world, and your behavior, and how that does for your patients, for your coworkers. Um, Protect your health, question after absolutely everything. Question everything. Follow the money. Don't take superficial answers. Just don't keep asking questions until you get to the root of things. Um, and yeah, the main thing is take care of your body. Read this book, get your sleep, eat organic food, drink more water. However much water you're drinking, drink more because it's probably not enough. Um, you know, and I would really look into how things like sugar, social media, all types of media really are affecting your nervous system in particular and your brain. Uh, you know, Sugar is, I think, should be banned, honestly. And this is because of the damage it does. The damage, it reduces your cognition. It causes inflammation. It does a lot of things that are really detrimental to us as individuals and, collectively as, communities when we can't think clearly because our brains are so inflamed, and it specifically affects your executive function, your ability to make good decisions. So, and the bottom line is, learn systems thinking, ask the questions, who does this help? Who is benefiting? Who does this harm? And protect your mental clarity at all costs,
I was just listening to you talk about sugar, and it immediately I had a flashback. I don't know if you remember, if you know, years ago, as part of the, quote unquote war on drugs. And there was the commercial with an egg in a frying pan, and this is your brain on drugs. And
Yeah.
that's exactly the picture I got as you were talking. And I thought to myself, if you did a commercial that says this is your brain on sugar, that would never fly.
I know.
That would never fly.
Yeah. And it's a hard thing. I understand. I mean, it's in 80% of every grocery store food, which is,
Mhm,
you know,
mhm. Yeah, it is.
it's hard to get away from, but you got to do your best because it's honestly the best thing for your brain and for your body. And I think when you really study the effects on your brain, uh, well, I should say I came to the conclusion that I felt like I did not have full autonomy.
Hmm.
I did not have full autonomy because I was being impacted by this. Um, so yeah, I actually went 100% sugar-free for a year.
Hmm.
So I have a little bit now and again, but I think just a total detox of your system
Of your
is
system, of your system. Yeah, 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 yeah.
Mhm.
So that brings me to my last question, which is usually about self-care, because I think that we don't, as much as we're talking about, I think we still don't talk about it enough.
Mhm.
We talk about it very superficially.
Mhm.
So what does it mean to you, and what do you do to care for you?
Um, I think at the core of self-care is defining your values and honoring your boundaries.
Hmm. Hmm.
I think that giving yourself grace as you learn new ways to deal with things and unlearn the things that no longer serve you and
Yeah.
that around you, um, is the only way to really align your life with what you believe, and not with what the system
What this?
demands.
Hmm. Yeah.
So some of the things that I do to practice self-care are, you know, practicing nervous system regulation. Um, I have a very significant trauma history, and so that is really essential
Hmm.
for me. And so I avoid alcohol, I limit sugar, I grow my own food when I can. Um, and I eat organic at every opportunity. I reconnect with nature frequently,
Hmm.
and I enjoy solitude. Um, and one of the things that I do every day, or most days, really, and especially if I feel like I'm having a more difficult day, is to listen to evidence-based affirmation videos. Um, I actually design these from research in neuroscience and behavioral psychology.
Mhm.
And they have, there's binaural beats and, some other things that are good for your nervous system. And I've designed them in a way that works with your RAS, your reticular activating system, which I have found that most affirmation videos don't do.
Don't.
They don't do that. And so, yeah, I took a lot of care to this, and I listen to it nearly every day. So, yeah. But yeah, there's a lot of things that I do otherwise. They're just kind of part of my, daily routine, but especially when I'm feeling dysregulated, like
Mhm.
lowering input, just, turn off the sound,
Turn off the, yeah,
just breathe. Breathing exercises are so underrated.
yeah,
So yeah,
yeah,
breathing, stretching, just
yeah,
focus on your body and how you feel.
yeah, yeah. Two things you mentioned there that really stuck with me. The first one is you talked about when the first thing you said was knowing what your values are. So important.
Yes.
So important because if you don't know, you're immediately out of alignment.
Well, yeah, sure. I mean, if you know, and so many of us learn this the most difficult way, right?
Yeah, yeah, yeah.
That, and it may not even be the values so much as the boundaries, right?
Yeah,
We, don't necessarily learn how to identify and enforce.
yeah,
But yeah, you have to know
yeah.
what your values are in order to know when they're being violated.
Right. Exactly.
Either
Exactly.
by your own self, because you are not behaving or acting or speaking in ways that are in alignment with, your own
Mm-hmm.
values, which causes harm and distress to yourself, right? But also when, you are asked to violate those or coerced to violate those by others, it helps you stand your ground and, say, this is not for me.
This is not what it.
I will not participate in this. I will not support this or
Yeah,
whatever that thing is. But
yeah.
yeah, essential for
Essential,
just
essential.
every. Mhm.
Yeah, yeah. And the second thing you mentioned also was that how important breathing is. And when I talk to people about this, that is one of the things that really strikes me is that we don't um pay much attention to the things that happen naturally. So, for example, we don't pay attention to our breathing. We don't pay attention to the way our body works
Mhm.
without us telling
Yeah,
it. We just take those things for granted and don't see them as things that we should protect.
correct. And yeah, and we are well trained to do that. We are
Exactly.
well trained to ignore our bodies, to not
Hmm.
pay attention, to
Yeah,
override, and people do it all the time. They
yeah,
forget to eat, or they haven't, had a drink of water in 5 hours, or like, oh my gosh, I've been so busy and I've, I'm, or, this is a big one for me when I have pain, and I do have significant chronic pain, like when that starts flaring up, I, my tolerance for things goes way down. My whole
hmm
mood shifts, and
yeah,
I've been so accustomed to sort of ignoring that, just pushing through it,
yeah,
that, it doesn't help me and it doesn't help the people around me when I'm not
yeah.
taking care of myself.
Yeah,
So, yeah,
exactly.
yeah.
Exactly. Exactly. Jennifer, thank you so, so much for this conversation. It has been so interesting and so insightful. Thank you very much indeed.
Well, thank you so much for having me on, Dale. I appreciate it. And Yeah, I've got tons to talk about if you ever want another show.
We will do that. We can do that. Thank you.
Yeah,
It's been my pleasure.
okay. Thank you so much. Bye-bye.